Hello dear colleagues, how are you today? I hope you are well. Here we are going to explain another question of cardiology. A 62-year-old woman who had a stroke a year ago now reports having increased dyspnea on exertion. An ECG was performed which showed an atrial fibrillation. Chest X-ray shows a straight left heart border. This is important. Atrial fibrillation and straight left heart border. It shows that the left atrium is enlarged. What is the single most likely diagnosis? A. Aortic regurgitation. B. Acute mitral regurgitation. C. Mitral valve prolapse. D. Pulmonary stenosis. E. Mitral valve stenosis. And the answer is mitral valve stenosis because we have straight left heart border as we said, and atrial fibrillation. It means that the mitral valve is stenosed and it leads to enlargement of the left atrium. Here we are going to explain it. Explanation. The clincher here is the chest X-ray that shows a straight left heart border. This is classic for mitral stenosis where the left atrium enlarges. The rest of the symptoms also match the diagnosis of mitral stenosis. The history of stroke given in this question is a clue that she has had atrial fibrillation for a while and had a systemic embolism due to stagnation of blood in an enlarged left atrium. Here we can say a mitral valve stenosis in chest X-ray. This is an enlarged left atrium as we can see here. This is showing a normal left atrium, and it's we have here normal left atrium, left ventricle, right atrium, and a right ventricle, and the chest X-ray is normal. But here we are seeing an enlarged left atrium, which we can see in progress patient. We can see right side, straight right side of the chest X-ray. Straight left side of the chest X-ray. Here we can see also the left side of the patient is straightened, and we can see that the patient has the enlargement of the left atrium because of the stenosis of mitral valve. Okay, mitral valve stenosis, most commonly due to rheumatic fever, results in right ventricular failure, as we said, when the right atrium tries to push the blood from the stenosed valve to the left ventricle. When the valve is stenosed, it's push the blood with a force, and it in prolong it leads to the enlargement of the left atrium, and the stagnation of blood in the enlarged atrium leads to the atrial fibrillation and the emboli. Okay, etiology. Most cases are secondary to rheumatic fever, and this is very important for the exam. Pathogenesis. Mitral valve stenosis impairs left ventricular filling. Increased left atrial pressure is referred to the lungs, causing pulmonary congestion. Forward cardiac output becomes reduced. Secondary pulmonary vasoconstriction occurs, and eventually the right ventricular failure results. The untreated mitral stenosis can lead to the left atrium enlargement, and in the prolonged it can lead to the right atrium enlargement and failure also. Clinical symptoms usually manifest slowly over years, like dyspnea, orthopnea, paroxysmal nocturnal dyspnea, right-sided heart failure, hepatomegaly, ascites, and peripheral edema. Okay, less common presentations like hemoptysis due to the rupture of pulmonary vessels due to raised atrial pressure, and systemic embolism due to stagnation of blood in an enlarged left atrium, as we can see in the Patient's history. Physical signs like muller flush on the cheeks, atrial fibrillation, pulmonary rolls, and loud S1. This is important. Diastolic rumble like low-pitched apical murmur. The diagnosis is with first ECG. ECG may show signs of right ventricular hypertrophy, signs like tall or waves, deep S waves in V6, V5 and V6, as we can see here, deep S wave in V5, V6. In this ECG we can see also deep S waves, okay, and inverted T waves in V1 to V3. Here we can see it also, inverted T waves in V1, V2, V3. We can see here in V4, V5. We can see here inverted T waves also, and here we can see also inverted T waves. Atrial fibrillation may be seen, okay, and P mitral or bifid P wave in atrial enlargement we can see, as P wave is showing atrial contraction. In a normal heart we have one P wave which is showing the contraction of the right and left atrium, but when we have atrial enlargement we can see a bifid P wave, which P wave is like M, or it has two parts. If we have right atrial enlargement, first part can be bigger, but if we have left heart enlargement, the second part of the P wave can be more prominent. Okay. Chest X-ray. In chest X-ray, as we said, we can see large left atrium and straightening of the left heart border, as we said, and we can see in this photo also. This is the photo of the patient coming with left side of the heart enlargement. Left side is straightened, and the patient has left atrium enlargement because of the mitral stenosis. Okay, pulmonary hypertension, including cardiac bill lines and increased vascular markings. Okay, echocardiography. In echocardiography, we can see thickening of mitral valve leaflets. As we said, the most common cause of mitral stenosis is rheumatic fever. It's secondary to rheumatic fever. Here was a short explanation of the patient coming with mitral stenosis. Thank you for your attention.